Life's pressures can make anxiety overwhelming, affecting health, work, and relationships. In the mid-20th century, a breakthrough changed everything. Leo Sternbach discovered chlordiaz epoxide, Librium, the first benzodiazepine. Librium was safer than barbiturates, offering hope to those with crippling anxiety. It worked by enhancing GABA, a calming brain chemical, quieting anxious thoughts. For the first time, people could manage severe anxiety and regain control of their lives. Librium's success led to other benzodiazepines like Valium and Xanax. But Librium was the pioneer, marking a new era in mental health treatment. It wasn't just for anxiety. Doctors used it to calm patients before surgery too. Its impact was global, quickly becoming one of the most prescribed medications. Librium's legacy is its targeted approach to calming the mind. It remains a symbol of hope for those seeking peace from relentless anxiety. Librium calms the brain by boosting GABA, the body's natural brake system. This makes it highly effective for severe anxiety, restoring balance at a chemical level. One of Librium's most vital uses today is managing alcohol withdrawal. When someone dependent on alcohol stops drinking, their brain can become dangerously overreactive. Librium steps in, stabilizing the nervous system and preventing life-threatening symptoms. Its long-acting nature provides steady relief, making detox safer and smoother. Doctors gradually taper the dose, allowing the body to adjust without sudden shocks. In this context, Librium can be life-saving, guiding patients through a critical recovery phase. Its steady sedation is crucial for preventing dangerous withdrawal spikes. Librium's role in alcohol detox highlights its unique value in modern medicine. For many, it's the bridge to a safer, healthier future. Librium was once widely prescribed, but over time, risks like tolerance and dependence became clear. Librium has some serious drug interactions with other medications such as apalutamide, hydrocodone, buprenorphine, conivaptan, dacomitinib, enzalutamide, fentanyl, fexinidazole, idelalisib, ivosidenib, lonafarnib, methotrexate, metoclopramide, intranasol, nefazodone, olopatadine, intranasol, opicapone, remifentanil, selinexor, sufentanil, thalidomide, tolcapone, tucatinib, valerian, zuranolone. Librium also has some black box label warnings such as risk from concomitant use with opioids, which can cause respiratory depression, risk for abuse, misuse, and addiction, which could cause overdose or death, and severe dependence and withdrawal reactions that can lead to severe life-threatening withdrawal symptoms. Today, it's no longer a first-line treatment for chronic anxiety. Safer options like SSRIs and therapy are preferred. Librium's use is now specialized, mainly for short-term, acute situations. Its primary role is in hospital settings for alcohol withdrawal or severe anxiety before procedures. Prescriptions are limited to minimize dependence, focusing on immediate needs. Compared to fast-acting drugs like Xanax, Librium's slow onset and long duration make it ideal for steady sedation. This distinction guides doctors in choosing the right medication for each patient. Librium's unique profile makes it less suitable for panic attacks but perfect for continuous calming. Its careful use reflects a shift towards safer, more holistic mental health care. Librium's story is one of evolution, adapting to new knowledge and patient needs. It remains a valuable tool when used with precision and caution. Librium's power demands careful use and close medical supervision. Side effects like drowsiness and confusion mean patients must be cautious, especially with driving or machinery. Other side effects to be aware of are ataxia, or trouble with balance or coordination, respiratory depression, tachycardia, fever, swelling of the face, itching, skin rash, hives, nausea or vomiting, and stomach cramps. Mixing Librium with alcohol or other sedatives can be fatal. You should avoid or take precautions when taking Librium if you are pregnant, or plan to be if you're breastfeeding, if you are under 6 years old, if you have closed-angle glaucoma, if you have renal or hepatic disease, suicidal ideations, if you are a geriatric adult, and if you have Parkinson's disease or myasthenia gravis. As a controlled substance, it's tightly regulated and prescribed for the shortest time possible. For mild anxiety in adults, 5 to 10 milligrams is recommended as an initial dose. For mild anxiety in geriatric patients, 5 milligrams is recommended initially. For mild anxiety in children, 5 milligrams is recommended initially, and max 10 milligrams in children. For alcohol withdrawal in adults, 50 to 100 milligrams is recommended as an initial dose. For adults with renal disease, half dosages are recommended. Stopping Librium suddenly is dangerous. Doctors create tapering plans to prevent withdrawal. Librium is not a cure, but a temporary aid for acute crises. Long-term wellness relies on therapy, lifestyle changes, and safer medications for chronic anxiety. Used wisely, Librium can stabilize patients so they can pursue deeper healing. Its legacy is profound, but its risks are real. For the right patient, under expert care, Librium offers a path to calm and recovery. The best medicine is not just powerful, it's used with wisdom and care. If you have acute anxiety or think you are having any symptoms of alcohol withdrawal, you should ask your provider if Librium would be right for you today.